We're pleased to announce the launch of VOR Training. VOR Training allows us to customize our training for our patients that need VOR adaptation exercises. In the past, we haven't been able to do a customized approach because our instructions to the patient were very general. Look at this target, turn your head at a speed that you can just barely see, and keep doing that for 90 to 120 seconds. Now we have the ability to use our gaze stability test results to customize our activities that the patient will do at home. We also have the ability for the first time to be able to combine balance training and VOR training. And this is a really exciting bit of progress for us because we know that in real life our patients need to integrate both the VOR and the balance system to be successful in their balance activities in the community. We're now going to do a demonstration of the VOR training module. So I'm going to click on VOR training. I have the option of training in horizontal, vertical, or in roll. We're going to train our patient today in the horizontal, and I'm going to initialize the tracker. Once the tracker is initialized, you come to the VOR training screen. And you have a lot of options here for customizing the exercise for the patient. So if you look at training settings, you have the ability to change your visual target. Do you want an optotype? Do you want words? Do you want to make a custom text? You can do all of those things. You can have the visual target come onto the screen only when the patient achieves the optimal velocity, and it will disappear from the screen if they are not at the optimal velocity. You have the ability to change backgrounds. Do I want colors, stripes, or do I want to keep it really simple and just have a plain white background? The objects or the backgrounds have a lot of different levels, level 1 being the easiest and level 5 being the most difficult. I have the ability to allow the system to only track and show the aptotype during a sweep to the left side or a sweep to the right side. If I really want to focus on the patient's VOR to the left side, I can only have the optotypes or the targets appear to that left side. The default, though, is that the visual target is going to appear to the left and to the right. I have the ability to adjust the training distance, the size of the optotype, the head velocity, the training time. In this case, the head velocity is defaulted to the patient's GST score. So I tested my patient, we did the GST, and the lowest score, the slowest side that the patient had the most difficulty with, that is going to be the default. So I know exactly where I can start my patient for the appropriate speed for retraining. The system will create a metronome speed for me. So we know that the degrees per second in head velocity and metronome beats per minute do not match up exactly because a calculation has to go into the metronome speed that includes the amplitude, how far the head is moving, as well as acceleration and deceleration. So that is done for us, and we have the metronome speed pre-calculated for us based on the head velocity. We also have the ability now with this new software to do balance at the same time that we're doing the VOR, because we know that when we're walking around and living our daily lives, we need to incorporate both balance and VOR in order to function in our communities. So for the first time, we have the ability now to do VOR and balance at the same time. We have the ability to do balance on a static system or a dynamic system. And for this demonstration, I'm going to show you the VOR training just on its own without any balance. I'm going to show it to you on a static system, and I'm also going to show it to you on a dynamic system. So my patient Daniel is coming back for some therapy. We tested his GST and his DVA and his perception time and his static visual acuity on his last visit, and now we are going to start him on some VOR training. So before we start, I want to make sure that Daniel can see the monitor. Great. Daniel is very dizzy. He's been having a lot of trouble with dizziness, and that's why he's here, going to have some VOR training. So for this particular VOR exercise, I'm going to keep the settings very simple as I can. I've got Daniel seated in a chair. I'm not challenging him from a balance perspective. I'm going to make sure that I don't challenge him beyond his GST results. So his GST results were 81 degrees per second. I'm going to keep my visual target to an optotype. That's what he's used to. And I'm going to start with visually velocity dependent, just so you can see what that looks like on training. When I hit start, we get the same type of startup screen that we do for testing. I'm going to teach Daniel about the amplitude bars, 20 degrees to either side. Daniel, can you move this little purple icon over to the 20? Good. And the other side? Great. So that's the amplitude. That's the excursion that I want your head to move. And if you listen to the metronome, Daniel, you can hear the pace. So each time the metronome goes off, I want you to hit one of those red uprights. Good. I want you to move your head a little bit farther. That's great. Now I want you to tell me which way is the E going.
Left.
Great.
Up.
Great.
Left.
How are you feeling?
Okay.
Good.
Down. Right. Up.
Great. And I'm going to stop the training. So what you saw was that optotype was flashing. And that's because every time Daniel sweeps to the right or to the left, he's got to stop at the end in order to turn around and go the other way. So velocity dependent means that every time he stops, that E is going to disappear. And that'll happen no matter which visual target you choose. Okay? Do I want to save this training trial? I don't want to save this one, because what I'm going to do is I'm going to change this a little bit. I'm going to repeat the trial, and then I'm going to uncheck velocity dependent. So what this is going to do, it's going to keep the optotype on the screen the entire time we do the training. I'm just going to show you this one more time in this mode so that you can see the difference. Go ahead and start moving your head, Daniel. When he hits the appropriate velocity and amplitude, I'm going to start the...
Down.
Good.
Left.
So you see the difference here.
Down.
Now the optotype stays on the screen the entire time.
Up.
And I'm going to stop the training. Now, after we're done, we have the option to save or to discard. When we save a trial, the settings that we choose then become the default settings for this patient. So if I save this, then next time when I go in to do VOR training, these settings will be saved for Daniel. I can put a comment in here that Daniel felt sick to his stomach, got a headache, whatever the case may be. Or maybe this level was very appropriate for him, and this was the level that we set him home with for his home program. I'm going to click on OK. Then I have the ability to repeat or to look at my daily report. I'm going to wait and show you the daily report at the end, and right now we're going to move to having Daniel do some VOR training with balance work. So for this one, when I repeat this trial, I'm going to click on Collect Balance Data. So you're going to be able to see how this works when I collect the balance data. Daniel is a great patient, and he's doing very well with his VOR training. So today we're going to make things more difficult for him. He is going to do his VOR training exercises while we are challenging his balance. And today we're just going to have him standing on a stable force plate, and while he's doing the VOR training exercise, we're going to measure how stable he is from a balance perspective. I've changed the settings here, so for training, we've now made the VOR training more complex because he's going to have to identify words, and I've made the background more complicated. He's going to be seeing a checkered background, which is going to make it more visually confusing for him. I've I've checked the box that says bring to front to give him a bit more of an attentional cue to the center of that screen. Also, if I'm having him try to read words against that black and blue checkered background, some of the words can be difficult to see if they are on top of a black square. So that bring to front is a really nice feature to have. We've changed our training distance. We're now at 4 feet based on how far Daniel is away from the screen. And what you'll see as we go into the training is we don't have up, down, right, and left like we did with the optotypes. These are non-directional. These are words, so we don't have a direction associated with them. We just have correct and incorrect. So the up arrow is correct and the down arrow is incorrect. I'm going to hit the start button. Go ahead and practice your head movement, Daniel. Great. And we're going to start.
Moon.
And he got that correct, so I'm going to give him an up arrow.
Winter.
Correct.
Simple.
Correct.
Warm.
How are you feeling?
Okay.
Great. So I'm going to stop that training exercise. What I'd like to bring your attention to on the screen is the training results. Before you print out a full report, you can get an idea of how well your patient is doing during the training exercise. So what you see is the actual training time. We just spent 12 seconds doing training. His average head velocity is 84 degrees per second, and we asked him for 81 degrees per second. So that's a very reasonable head speed. His compliance was 75%. He got 3 words correct out of 4. Actually, he got 4 correct. It was the operator error that gave him that 3. So you can see here, from this screen, you can get a sense of how was Daniel doing in terms of symmetry of his head movement. Is he moving in the appropriate speed? And is he moving symmetrically when he sweeps to the right and sweeps to the left? Do I want to save this training trial? Yes, I'm going to save the training trial. And I can put a comment in here as well. Now we're going to move over to the dynamic system, and we're going to make things even more challenging for Daniel. We now are progressing Daniel to a more dynamic balance challenge while we progress his VOR training. You can see Daniel's in the dynamic system right now. For the purposes of this video, he does not have a harness on, but for any patient that's doing these types of training activities, a harness is necessary for every patient. What you'll see on the screen when you go into dynamic conditions, the default training distance automatically sets to 2 feet. And that's because that's going to be the distance of Daniel away from the screen. If for some reason you wanted to turn your patient around and have them look out into the room for a different type of visual target, you can change this setting. You can move your other monitor to 10 feet away or however far away that it will be from the patient, and the patient can work in the dynamic system but turned around. If you don't have a dynamic system in your clinic, you can always use foam or rocker boards or different types of balance challenges right on your static system. I've made the VOR challenge more difficult for Daniel as well. I've clicked the button that says custom texts. There are custom texts built into the NeuroCom system, but if you click on the editor button, you can also edit some of these custom texts. You can put your own text in, and you can choose different colors and different fonts. I've also changed the background, I've changed the color, and I've changed the difficulty to falling objects level 5. When I click on the start button, we will have the same practice screen for Daniel, and we're going to start. And Daniel's going to have to do math and answer the equation. While he's doing that, the surface and the surround are set at responsive, and they're set at 20 and 40%. And what you can see is that Daniel has to move his head, do the math equation, and maintain his balance all at the same time. Now, for the operator, this is a bit challenging because I'm going to have to do math too and let him know if he's gotten the answer correct or incorrect by pushing the up or the down arrow. Good job, Daniel. So when I stop the test, you can see here that at some point in the middle of this exercise, Daniel stopped moving his head. And you can see that because the tracking of the trace of his head movement stopped in the middle of that trial. So that's something to keep an eye on when your patients are performing these exercises. And I would say, Daniel, were you feeling dizzy or off balance during that time? Off balance and dizzy during that period where he stopped his head movement. I didn't actually give him an opportunity to answer the question of whether or not he got that math equation correct in his head. So for this exercise, the compliance was 0. You can see that I've set the support and the surround. The support's at 20% difficulty and the surround is at 40% difficulty. They're both set at responsive. For Daniel, this was challenging while he was doing the VOR exercise. So if somebody is stopping their head movement in the middle of an exercise, that will indicate to the therapist that one of the tasks is too difficult, whether it be the VOR task. In this case, he was actually doing a math problem, so there was some dual task and competition for his resources, and also he had to maintain his balance stability. So all of those things put together were very challenging for him. So this training result gives you an indication of how the patient performed from a head movement perspective, and if they stop their head movement, then you know that something is very difficult. So I'm not going to save this trial because I'm going to make some adjustments. And so this is here, if I were to repeat this trial, I would make things a little bit easier. To make things easier, I can change the background, I can change the VOR task, and I can also change the balance task. So the next thing I'm going to show you is the report that's generated after you finish your training and you're ready to send the patient home with a home program. Now we're going to take a look at the results of the training exercises for today. So if I click on Daily Report, I can see a recap of what we did in VOR training. So for Daniel, we did a training time of 18 seconds. This one was on the dynamic force plate, so we were also looking at how stable he was while he was doing the VOR exercise. His average head velocity was 70 degrees per second. We get the results of his original GST test so we can see where he started, and it gives us an idea of where we might need to go in terms of setting our goals. His compliance with this exercise was 63%. We had him reading custom texts, and he got 5 out of the 8 correct. We set the training time for 60 seconds. We just stopped it a little bit early because he complained that he was getting dizzy. Our target head velocity was 81 degrees per second, and that was brought over from the GST results. His testing distance was at 2 feet, and that's because he was standing in the dynamic system. His visual target size was at 0.10 logmar, and that again came over from his static visual acuity test. We didn't have the optotype set at velocity dependent. We wanted it to be on the screen the whole time rather than doing that blinking effect every time he changed directions with his head. You can see down here below the training results, we have a symmetry box that allows us to see if his head movement was symmetrical to the left and to the right. And for Daniel, it was very symmetrical. And from a balance perspective, we get to see how well he maintained center. When we're doing balance training, along with the VOR training, we want our patient to be as stable as possible. We want them to be able to maintain center and keep it at center while they're doing this exercise. Well, Daniel had a lot of challenges. The support and the surround were set at responsive, so every time he shifted his weight, the support and the surround moved. He was also doing a very difficult VOR exercise. He had a dynamic visual background. He was also doing some difficult calculations while he was trying to do all of these things at one time. So you can see from the weight trace that he did not maintain stable in the center. He had quite a bit of sway. So this is a nice visual to allow us to see how stable somebody is while they are doing VOR and balance training combined. If I click on the next tab over, That's the raw data tab. And the raw data tab is going to allow me to see how Daniel was doing with his head position. Was he turning his head appropriately? Was he hitting the correct amplitude and the correct velocity? So the first graph is position. Was he moving symmetrically right and left? And was he moving far enough to each side? And the second graph is velocity. Was he maintaining the appropriate velocity throughout the exercise? The last tab is what I think is the most exciting piece of this software. As a therapist, I want to be able to have as much control over my patient's home exercise program as I possibly can. And this exercise instruction allows us to give the patient exactly what they need to do at home. So what you'll see here is you'll see a set of instructions that the patient can take home and read and make sure they are doing the exercise appropriately. Now these exercises are all editable. So if I'm a therapist and I read this and I say, oh, you know, I'd like to change this a little bit, or I like to have my patients work this way or that way, I can customize this even more by clicking on Edit Instructions, and then these become completely customizable for my patient. If I scroll down the exercises, I can see that given instructions to cut out the target and place it on the wall. The target is given to you down here in the optotype conversion chart. The patient cuts out these optotypes, and they know that when they stand at a certain distance away, that is the size optotype that's appropriate for them during the exercise. So if I look at this biggest optotype on the end, I can see that for testing distance, if I'm using the big E, I want my patient to stand 10 feet away from that target. So if my patient puts the E on the wall and marks a 10-foot distance, that's how far away they're going to stand when they're looking at that particular E. Down on the next line, it says marker distance. The marker distance is how far to the right or to the left of the target you're going to put a marker to help the patient know how far they should be turning their head. Because the amplitude is really important when we're talking about velocity. If the patient is moving not a large enough amplitude, they're actually going to be moving their head at a different velocity than if they move their head in a larger amplitude. So the marker distance is important to give the patient a visual cue. So if I have a marker over here and a marker over here, my patient knows that they're looking to move their head to those markers. So this is a really nice way to give your patient a lot of specifics on their home exercise program. They're going to be using the appropriate size target, they're going to be standing the appropriate distance away, and when they set the metronome speed to the speed that's discussed on the exercise sheet, you are going to know that they are working at the appropriate speed to maximize their adaptation to their VOR problem.